A husband and wife going through it together. Isn't that incredible?
That really is incredible.
It's amazing. Now, Mike urges other men to be familiar with their family history. That's a risk factor for men developing the disease. He also urges us men to really know our bodies and to do self-checks.
Absolutely. It's so easy. Well, most people who are diagnosed with breast cancer choose to have surgery, and we touched on this earlier, and as with most surgeries, there is a recovery process.
But it's important to know there is therapy post-surgery that can help you fight your battle and get you back to your normal self. So, joining us today to tell us more are occupational therapist Sally Hawkins and physical therapist Dominique Duchateau, both with Atlantic Physical Therapy. Ladies, thank you so much for joining us.
Of course.
Yeah, thank you.
Okay, so Sally, we've established this isn't just a woman's disease.
No, we've seen men and women in the clinic for breast cancer rehab. We do feel it's very important that men, like you were saying, do their self-checks. It's so important because men are being diagnosed, you know, it is 1 out of 1,000 versus 1 out of 8. But we do see more and more men with breast cancer and
it does
coming
happen.
in for therapy. Yes.
Yeah, okay, so maybe a lot of people don't realize that occupational and physical therapy is a part of treatment for many people after breast surgery. Tell us why and how.
After breast surgery, common symptoms include decreased range of motion. They might have increased joint stiffness, or they might have pain and chest wall tightness. So our goal in therapy is to help individuals restore their functional mobility in their arms so that they can return to their everyday activities, such as being able to return to work, take care of the children, return to their hobbies of interest.
And you say the sooner you get them, the better. Why?
Yes. We find that if you start early intervention of therapy, you can help to prevent long-term complications. We'd much rather see somebody come within a couple weeks of therapy with limited range of motion, let's say to here, versus 6 months from now.
Right.
Then we can regain that motion much faster.
Okay, so let's talk treatment. It really isn't a one-size-fits-all. It really depends on what kind of surgery the patient has.
Yes. When a patient comes in, we do a full evaluation. We look at their range of motion, their pain, their soft tissue integrity, and we also look at what kind of surgery. Did they have a lumpectomy, for example, versus a modified radical mastectomy? Do they have chemo or radiation? So those factors might influence how we do our exercise program.
And you've got some exercises to show us for how this works.
Yes. So we have different phases. Phase 1, we usually do the first couple 5 to 7 days of exercises, and we're very careful with having people work on their posture, as well as just simple shoulder exercises out to the side, out in front, in back. We also incorporate the ball. We might have people work on some ball stretches out to the side, out in front.
And these are, and like you said, they're not one size fits all.
Absolutely.
It just really depends on
the
surgery.
Yes, and then we also use a cane. We might have somebody work on bringing the cane up to work their shoulder, maybe side to side in order to work their trunk.
Right.
And then we incorporate also elbow to hand exercises to facilitate that fluid circulation and flexibility.
Dominique, let me ask you this. There's another complication post-surgery that we've got to watch out for.
Yes. It's called lymphedema.
Okay.
And what happens is all of the fluid in your arm drains into the lymph nodes up in your armpit area. So what happens surgically when they remove those lymph nodes and also do radiation, the fluid in the arm doesn't know where to go. So it kind of gets stuck. So the treatment program that we offer is comprehensive. It includes a manual lymphatic drainage, which is a very specific type of massage.
Okay.
And then we also incorporate what we use, it's called a lymphedema pump. Okay, and that is, I'll show you. It is an arm sleeve that goes on, you put your arm in here. This goes around your trunk, okay? And then this gets hooked up to a machine that inflates and deflates with air. So it's pumping the fluid up into your axilla area. Then we follow the third part of that is using a compression sleeve and a gauntlet for the hand.
Okay.
And this can happen any time after surgery, even 20 years later?
Exactly. We've had ladies who have had post-mastectomy, no complications whatsoever, and then 20 years down the road, they get on an airplane. That reduced cabin pressure can actually stimulate the lymphedema.
Wow.
So all of this is different for everyone. Be sure to check with your doctor, but the big thing here is education.
Yes.
Be informed.
Be informed.
Yeah. Thank you so much, ladies.
Thank you. Thank you very much.
So much.
And if you would like to read more from Atlantic Physical Therapy about services provided, go to WVOC.com and click on our picture at the top of the page. And the healing doesn't stop there today. For the millions of stroke survivors, burn victims, and arthritis sufferers who have trouble with their hands, there's hope through this glove. It's a healing glove, and it's all made possible through cutting-edge technology. Up next, we'll hear how it works and find out how soon it may be available for patients.
And just, I heard a little pop noise.
He's not talking about his turbo. He's talking about his iPhone. This young man's going to tell us why he says it was too hot to handle and what Apple thinks about that. Delmarva Live will be right back.